Emergency general surgery is currently available around the clock in 25 hospitals. To provide this, the RCSI says hospitals are heavily reliant on locum doctors and junior staff working excessive hours. It says overnight surgeries often happen because the service is poorly organised and not because the patient needs it at that particular time. In a report published and presented to the HSE today, the Royal College of Surgeons in Ireland makes a number of recommendations to improve the system. It wants the number of hospitals performing 24/7 surgeries reduced and a network system introduced with a coordinated system of care.
Patients have access to greater resources at their first point of contact with the emergency surgical services. We're recommending that every hospital receiving emergency surgery patients have an ASAU, an acute surgical assessment unit, because that will allow patients to be seen by a surgical decision maker, to have prompt diagnostics and to get an early diagnosis.
There are huge opportunities in our smaller hospitals to develop services that may be perhaps not so developed there at the moment. So there's no point in introducing change unless it's change that is good. And I can tell you for a fact that, by example, in Roscommon, it is a really good example of good change.
The RCSI says a networked approach will create a better working environment and help with retention and recruitment. This report recommends two types of hospitals for emergency surgeries. One would be operational for up to 12 hours during the day, while the second would be able to provide surgeons and diagnostics 24/7 if needed. The RCSI isn't saying what hospitals or where. That will be a matter for the HSE if it implements these recommendations. Diane Connor, RTE News.